Hi everyone, welcome to this webinar using an equity-focused population health approach to gender-based violence prevention to enable local public health action. My name is Nandini Saxena. I use she/her pronouns and I'm a knowledge translation specialist with the National Collaborating Center for Determinants of Health, and I'll be your host for today's session. So first off, before we get started, I'd like to share a land acknowledgement. And what you see up on this slide is the land acknowledgement that we use at the National Collaborating Center for Determinants of Health. And what you'll see is that the land acknowledgement is that the 1725 treaties of peace and friendship between the Mi'kmaq and the Wolastoqiyik peoples and the British Crown do not deal with the surrender of lands and resources, and instead recognize Mi'kmaq and Wolastoqiyik title and created rules for what was intended to be an ongoing relationship between nations. And for myself, I'm joining from Treaty 13 territories, which is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and which continues to be home to many Indigenous peoples from across Turtle Island. Importantly, Treaty 13 was established in 1805 at a time when Black people, forcibly brought to Turtle Island through the transatlantic slave trade, were enslaved or actively resisting enslavement, and when the enslavement of Black people was a common practice among members of the early Upper Canada legislative assemblies, which is now located in Ontario. So a bit of background about the National Collaborating Centres for Public Health. So NCCDH is one of 6 national collaborating centres and is a program we're funded by the Public Health Agency of Canada, and we were created post-SARS to really work to strengthen public health across the country by sharing and supporting the uptake of different forms of evidence. So each of the 6 centres has a particular focus. And the focus for NCCDH is to support public health to take action on the structural and social determinants of health and to advance health equity for all. And as referenced, we are located in Mi'kmaq, now known as Nova Scotia, and we're hosted by St. FX University. A few other housekeeping items. I invite you to use the chat box for conversation and connection with other participants and with the speakers. You can start by introducing yourself and where you're from. And I think you've already seen that Diane Oikel, one of my colleagues from NCCDH, is moderating the chat box and will be sharing any relevant resources in the chat box as we go along. You can also use it to share resources that you have and that you might want to share with others. And you can use the chat box as well to share comments with everyone. You can share your questions for the speakers in the Q&A box, which you'll find at the bottom of your screen. And for some of you, you might see a More button on the bottom right with 3 little dots. And if you go there, for some of you, that might be where you find your Q&A box where you can share questions for the speakers. You can also use the automatic Zoom closed captioning function for English, and you'll find that CC button at the bottom of your screen. And a last housekeeping note is that our conversation today will be recorded and it will be shared with registrants via email and also posted onto our website. So on that note, I would like to introduce our group of fabulous speakers who I believe are all going to turn on their cameras now so we can see their lovely faces. So I'm excited to welcome our 5 speakers today. So Marianne Stewart and Leah Depore work in local public health units in Ontario. So Marianne is with Thunder Bay District Health Unit and Leah is with Southeast Public Health. And then from Lakehead University, we have Dr. Helen Muller, who is with the university's Department of Health Sciences, Nana Narkua Oduro, who is in the MPH program there, and Oriana Rodriguez, who was a research consultant on the project. And I'd also like to highlight that Daphne Meyer, who you see located on the slide in front of you, was also part of the core project team to develop this framework, but is not joining us today. So on that note, I will hand it over to Nana to get us started with this presentation.
Thank you very much for the wonderful introduction, Nandini. Good afternoon, everyone. We are very pleased to be here with you all today to be talking about this very important topic of gender-based violence. Next slide, please. So we want to acknowledge that some of the content of today's presentation can be upsetting, disturbing, or otherwise difficult to think about. Please prioritize your well-being and please be aware that help is available if you need the resources or assistance. Next slide, please. So this presentation shares the equity-focused population health approach to preventing gender-based violence, also known as GBV, its development and its application at the local level. The framework provides a roadmap for preventing gender-based violence, which are understanding the factors and conditions that shape gender-based violence exposure and inequities in population, identify action to prevent gender-based violence in the population, create conditions for healthy, safe, and equitable relationships, and reduce the negative outcomes for people who have been exposed to violence, and support perpetrators to stop using violence, as well as clarify the scope and roles for local public health in gender-based violence prevention and explore strategies to effectively and sustainably apply this approach. There is more information in the framework than we can share in this presentation. So the framework, can be downloaded from Thunder Bay District Health Unit's website at tbdhu.com/GBV framework. And the framework also includes the reference list, for the materials in this presentation, and the page numbers for the related content in the framework are highlighted on these slides. So just please keep note of that. Next slide, please. So the framework was developed through a locally driven collaborative project funded by Public Health Ontario, and we are very grateful for this support. Next slide, please. Development of this framework would also not have been possible without contributors from many individuals and organizations. However, due to time, we are not able to list them all out individually, but we are very grateful for all of their time, expertise, and perspectives. Next slide, please. So our learning objectives for today will discuss the role of evidence-informed public health decision-making and community engaged research in the development and dissemination of the framework, discuss the framework and how it supports users to understand and take action to prevent gender-based violence, illustrate how the framework can be applied at the local and regional level to support a whole of society response, and identify the scope and roles for local public health within gender-based violence prevention efforts. Next slide, please. So before we get started, we wanted to check in and see what brings you to this work on gender-based violence today. So please just scan the Slido barcode over here, the QR code, or you can join at slido.com and the code number is 1324398. And we would love to hear from you as to what brings you here today. I see people are typing. Awesome. Great. Great stigma. Okay. Reduction. Awesome. Learning. To learn more about the framework, prevention, understanding. Awesome. We're loving this. We're very happy to hear from you. Prevention is a big one. Learning. We're all lifelong learners. So it's very good that we're all here to learn, even though some of us may be well versed in the topic, but we appreciate you being here today. Next slide, please. All right, so we also are wondering where your organization is at in regards to focusing on gender-based violence as a priority topic. So this is the same Slido as well. I'll read out the question and then I'll read out the responses. So, which of the following best describes the extent to which your organization has considered or focused on gender-based violence um, as a public health topic? Is it A, we have done extensive prevention work in our community? Is it B, we have done some prevention work in our community? C, we have started exploring this topic. D, we are considering whether and how to start work on gender-based violence prevention, but have not yet started. Or D, other comments that you'd like to share. Okay, great. I see the answers here. And a lot of people are saying, A, we have done extensive prevention work in our community. That's awesome. We're very glad to hear. Some people have done some work in their community, and some are starting out. Awesome. Thank you very much for engaging in our questions and our conversation, and we hope to hear more from you. And now I will pass it on to Oriana, who will provide key background information on how gender-based violence has been defined in the framework before we get further into sharing the framework. Thank you, Oriana.
Thank you, Nana. So as Nana said, we wanted to first clarify how we defined gender-based violence in this work. And we used the Government of Ontario's definition from Ontario Stands Action Plan, which describes gender-based violence as an umbrella term for harmful acts such as physical, sexual, emotional, psychological, or even economic abuse that is rooted in someone's gender or unequal power dynamics. Gender-based violence can look like human trafficking, sexual assault, femicide, stalking, intimate partner violence, or family violence. And it is important to understand that it can affect people of all backgrounds, genders, and ages. And while there are some groups that face greater risk, it can impact anyone. So with this definition in mind, we'll now explore how gender-based violence shows up in people's lives. Thank you. So to help describe the nature and scope of gender-based violence, we adapted the WHO's typology of violence. So our adapted version focuses specifically on interpersonal violence, which occurs between two or more people. And this typology helps illustrate that gender-based violence has many different forms, which are highlighted in this graph. And violence occurs in person, but increasingly can also occur through digital avenues, such as social media platforms, apps, technologies like location tracking tools that are often embedded in smartphones, computers, and other widely available devices. And it is also important to note that gender-based violence happens across the lifespan. And the type of violence and the relationship between the person using violence and the person experiencing it may differ at different stages of life. So understanding these forms of gender-based violence sets the stage for exploring its impacts in our next slide. Thank you. So gender-based violence has both direct and indirect impacts on population health and on the broader conditions that shape health. And it can have immediate consequences, which include psychological distress, physical injury, STD infections, and unwanted pregnancies. But impacts can extend far beyond the immediate harm and can have long-term and intergenerational consequences, which ripple out, affecting mental health, chronic disease risk, economic stability, family well-being. It can affect workplaces, community health, as well as society as a whole. So given those far-reaching consequences, there has been a growing recognition of the need for a coordinated public health response, which brings us to why this framework was developed in the first place. And our next slide, please. Thank you. So to understand why this framework was developed, we first want to begin by grounding this work in its broader historical context. This framework did not emerge in isolation, and it was shaped by decades of advocacy, policy development, tragic events, and growing recognition that gender-based violence is a pervasive and preventable public health issue. So this timeline highlights key moments in Canada's response to gender-based violence with a focus on Ontario, as this is the context we are operating in. And as we see here, while large-scale efforts to address gender-based violence are relatively recent and largely driven by women's rights advocates, strategies have emerged across federal and provincial levels as well, typically led by ministries focused on gender equity, social services, and public health, and public safety. But public health has rarely been explicitly included in these discussions, despite the clear links between gender-based violence and social determinants of health. So recent public inquiries, including the Mass Casualty Commission and the Calton, Cusick, and Warmerdam inquest in Ontario, have reinforced this urgency of change and explicitly called for a public health approach, including declaring intimate partner violence an epidemic on a provincial level as well as nationwide. So there is growing recognition that gender-based violence must be addressed through a coordinated public health response, but this also highlights the limited involvement of the sector so far. Can we move to our next slide? So before this framework, there were really only a few public health-led efforts, such as the National Strategy on Family Violence and Child Maltreatment, and some prevention resources developed in Quebec. But despite these efforts, there was really no practical guidance to support local public health action on gender-based violence, especially in Ontario. Recently, though, there has been a push for change as local public health units are very well positioned to mobilize community-wide responses, because they have access to local data, community partnerships, and evidence-based approaches to address the root causes of violence. Next slide, please. So why was this framework developed? This framework was really created to bridge that gap between the growing calls for a public health approach to gender-based violence prevention and the limited guidance available for local action. And it really aims to define and support the role of local public health agencies, apply a public health lens to identify new opportunities to reduce violence, and advance health equity at the population level. And while this framework was designed for public health professionals, it can also be adapted to support organizations outside the sector. So before we continue on to the framework, we just wanted to clarify what we mean by a public health approach. On our next slide, please. So a public health approach involves applying public health core functions and tools to understand and address issues affecting population health. So in this approach, the patient is not an individual, but rather a population. And that population may be defined by geography, by an institution, such as a school or a workplace, or by specific demographic characteristics. And as previously mentioned, this approach can be used both within public health as well as by entities outside this sector. And there are 4 basic steps to this approach. Step 1 is to collect surveillance data to understand violence within the population. And then based on this data, step 2 is to investigate why violence occurs and find and identify risk factors for violence as well as protective factors. Once this has been defined, step 3 is to take action by developing prevention initiatives and implementing evaluation tools to understand what strategies work and for whom they work. And the 4th and final step is to build on these successes by expanding the use of effective and promising prevention initiatives. So with this background established, I'll now pass it on to Helle, who will dive into the actual framework.
Thank you so much, Oriana. I will provide an overview of the research process that supported the development of the framework. Next slide, please. So reflecting the rationales for developing the framework, the aim of our research was really to enhance the efficiency and effectiveness of local public health agencies' approaches to gender-based violence prevention by strengthening public health professionals' understandings of both determinants and the risk and protective factors, and also the preventative actions that are within the public health scope of practice. And our research questions mirrored these goals. Next slide, please. The National Collaborating Centre for Methods and Tools Evidence-Informed Public Health Decision-Making model that you see on this slide, the multicolored flower with the 5 different components, that guided the design of our research approach. And people that are engaged in this kind of approach generally start with uncovering the local context of an identified issue, which Oriana spoke to. Then they explore the community, political, and public health actions and resources that are dedicated to address the issue, for example, through lit reviews. And hereafter, they develop and conduct research to determine best practices and potentially create guidelines and frameworks the way that we did. In the next few slides, I will speak to the lit reviews and the research process you see in points 2 to 5. Next slide, please. In relation to lit reviews, Southeast Public Health conducted a review of national, provincial, and territorial government responses to gender-based violence, intimate partner violence, and family violence. And this revealed that a public health perspective was largely undefined in national and provincial government strategies. So the research team followed up with 5 rapid reviews that focused on populations that weren't well covered in the other reviews, particularly people identifying as 2 as LGBTQI+, newcomers and immigrants, people that live in rural, remote, and northern communities, and people that have been identified as perpetrators of violence, and also health professionals who work to address gender-based violence. We also reviewed the recommendations from the Collagen, Cutzig, and Wamadam and the Mass Casualty Commission's inquests, and we reviewed public health frameworks from the National Collaborating Centre on Public Health, focusing on health equity, determinants of health, and mental health promotion. Next slide, please. We started the project in August 2022. It feels like several more years ago, but that's as early as it was. And in the planning phase, we synthesized the information from the lit reviews that I just spoke about. We synthesized them into a background knowledge document. This document informed the Delphi process that we used. You may wonder what a Delphi process is. It's a form of expert opinion research that is used to reach consensus on emergent issues and inform clinical guidelines where evidence is otherwise incomplete. It really provides a structured framework to draw on both expert opinion and the wisdom of the collective through iterative questionnaires. As part of the Delphi process, we conducted 2 rounds of surveys. You can see the timelines here, and held knowledge user meetings after each survey to address any questions for which consensus had not been reached in the survey. And after the first survey was done, we developed a draft of the gender-based framework that we presented for feedback in the second survey. And after the second survey and knowledge user meetings, the framework was adapted to reflect the feedback and insight from participants. And the adapted framework was further evaluated in the validation survey. The final edition that you all have access to include the feedback from the validation survey. And we have a research report that is coming that describes the full process. It'll be available as soon as we have finalized the editing process. Our hope is that the outcomes of this process will support continued collaborative efforts beyond the scope of the project, such as informing indicator and measurement development that local public health agencies can use to monitor gender-based violence, its determinants, its risk, and its protective factors, and also evaluation of prevention initiatives. Next slide, please. The goal of understanding and taking action to prevent gender-based violence are really 2 sides of the same coin. One must understand the determinants that increase or decrease the likelihood of gender-based violence exposure in order to identify prevention strategies. In the literature that had informed the background knowledge document, the socio-ecological model was often used to describe the nested determinants, factors, and conditions that shape the likelihood of exposure to health issues. And public health systems across Canada generally use the population health approach that Oriana described. So therefore, and also reflecting on the findings from the Delphi surveys, we wanted to apply a combination of the public health lens to gender-based violence and also the nested domains found in the social ecological model. We really believe that viewing health not as the absence of disease in individuals, but rather as the health of entire population can help explicate and also intervene in the dynamics that result in health inequities overall and leads to much broader benefits. Some of the key priorities from the Delphi panel was particular aspects from 7 frameworks that we presented in the first Delphi survey. Participants had a preference for 3 of the 7 frameworks that we presented, and the gender-based violence framework builds on the preferred aspects of those 3 population health frameworks. We realized that it wasn't possible to incorporate all the needed components into one image, so we asked survey participants and knowledge users for their guidance. And both the groups indicated that their priorities were information about prevention action and also advancing health equity. So in response, we developed the 2-part framework that you can see on the slide. Part 1 provides helpful and contextual information to understand the actions that are the actions-focused information that is displayed in Part 2. In combination, the 2 parts provide a roadmap for linking systemic drivers of inequity to actionable strategies for change. Marianne shortly will provide a little bit more detail on each of the parts. Next slide, please. Before she does that, over the course of the research process, I want to talk about, we realized that the concepts, determinants of health, and risk and protective factors are often conflated and confused. So clarifying these terms has been important to us. In the framework, determinants of health are understood to be factors at the structural, environmental, social, and individual levels that can shape the health of individuals, communities, and populations for the better or the worse. And risk and protective factors describe the relative influences within a determinant, and risk factors extension are associated with an increased probability of the health issue, while protective factors are associated with a decreased probability of a health issues. As such, the factors influence both the prevalence, the severity, and the inequities in the health issue. Next slide, please. On page 14 to 16 of the framework, you will find a table that outlines determinants that are linked to gender-based violence exposure and the related risk and protective factors. What you see here is an excerpt from that table. For example, on the top determinant, risk factors under the structural determinants include gender inequity, racism, colonization, and ongoing colonialism, which, along with other intersecting social inequities, contribute to social stratification and unjust and preventable differences in people's socioeconomic position and conditions and daily lives. The protective factors, on the other hand, are actions and legislation that in various ways respect gender equity and human rights. Our hope is that the information in the table can be used by local communities to identify determinants and opportunities for strengthening protective factors and reducing risk factors, particularly to their area. Next slide, please. So Marianne will now provide some more detailed information about the 2 parts of the framework and also talk now about what actions to enhance protective factors could look like. So over to you, Marianne.
Thanks, Hele, for that overview of the research process and the framework development. So as she mentioned, I'm going to take a bit of a deeper dive into the framework components. Next slide, please. And so you can see here that part 1 really focuses on building a shared understanding of those factors that shape gender-based violence at the population level. It illustrates the determinants of health in 3 key areas. So number 1, the likelihood of exposure to gender-based violence across the population. 2, people's experiences and recovery after gender-based violence exposure. And number 3, the processes that create inequities. So this is why some groups face higher risk, greater harm, or fewer supports. And together, these components can help us see that while gender-based violence occurs between individuals, the conditions that increase the likelihood of using or being exposed to violence are shaped by the broader environments that people live, work, learn, and interact in. And so understanding these determinants is the foundation for equity, focused and effective prevention. Next slide, please. And so zooming in on the structural determinants in the nested social ecological model that Helly was referring to earlier, if we start at the top and the nested puzzle pieces, the structural determinants are those big upstream forces that shape the conditions of daily life and in turn influence who's more likely to be exposed to gender-based violence. They include 3 interconnected areas that structural systems of inequity. So these are things such as sexism, racism, settler colonialism, ableism, and classism that shape how power and resources are distributed. Also, the policies that determine how opportunities, services, and supports are allocated, which can widen or reduce inequities. And 3, the social and cultural norms that influence what behaviors are viewed as acceptable and shape expectations across communities. Together, these forces influence both exposure to gender-based violence and access to safety, support, and recovery. They also shape the digital, social, and physical environments where people interact. And small strategic changes here, such as improving public safety, strengthening school or workforce practices, or enhancing digital protection, can reduce risk at the population level and often have a greater impact than interventions focused solely on individual behaviors. And the final level, so at the bottom of your screen, the individual factors, which includes knowledge, skills, attitudes, life course experiences, stressors, mental, physical, and developmental health. And these factors influence how people navigate relationships and the risk of exposure to gender-based violence. Historically, many public health interventions tend to focus at this level, aiming to build awareness or change behavior. Increasingly, and you'll notice this is a theme, we really need to move to upstream, to address the structural conditions and environments that shape the individual factors in the first place. Next slide, please. And so, as Helly mentioned earlier, the public health professionals that were involved in the research process identified how to take action to prevent gender-based violence as their top priority for the framework. And indeed, many of you did in the pre-webinar survey as well. And so part 2 is designed to meet that need. And this section really outlines the opportunities to improve population health by preventing gender-based violence exposure, reducing its consequences, and advancing health equity. And it's supported by principles to guide system-level planning at applicable local, provincial, and national levels, as well as broad action areas to support prevention. So the framework, you'll notice, doesn't prescribe specific models, interventions, programs, or campaign. The decisions are intentionally left up to local public health agencies and community partners to determine based on their unique strengths, needs, and context. However, part 2, as Helly alluded to earlier, really identifies those at the bottom of the screen, entry points to advance equity. So this has a goal both of reducing overall gender-based violence in the population, but also the inequities in who is most affected. And without this focus on equity, public health efforts risk unintentionally widening gaps rather than closing them. Next slide, please. And so zooming in on those structural actions and conditions, we really, again, with that upstream focus on the conditions that shape exposure to gender-based violence. And so these would include things like advocating for whole of government and whole of society approaches, strengthening policies that advance gender and social equity, advancing Indigenous-led strategies, and engaging boys and men in promoting healthy relationships. It also means shifting those social norms. For example, supporting initiatives that promote consent, gender equity, digital literacy, and human rights. And it includes advocating for policies that promote safety and well-being, such as affordable housing, income and employment supports, accessible public transit, mental health services, and substance use care, because these structural determinants directly influence risk and resilience. Across the key everyday settings, so in the middle of the screen, prevention can occur in practical ways. So at home, by supporting families with social and financial resources to create safe, stable, and nurturing environments, and strengthening caregiver capacity around healthy relationships and digital safety. And in learning environments, we can promote clear gender-based violence prevention and response policies that contribute to safer schools and campuses. And in our public spaces, we can shift norms around street harassment and improve safety. In our digital and media environments, we can address those harmful online behaviors and promote more safer, respectful digital interactions. Small but intentional changes across these settings can meaningfully reduce exposure across the population level. And then finally, on the right, at the individual level, where I mentioned earlier the focus here is on really strengthening knowledge, skills, and support so people are better equipped to build healthy, respectful relationships. So these can include developing those social emotional skills from early childhood through post-secondary education, supporting people to recognize and respond to early signs of violence, and strengthening I see that. I'll slow down. Strengthening protective factors such as mental health and substance use supports and life skills. For example, early childhood home visiting is one example of how strengthening families can reduce vulnerability and support healthier developmental pathways. Individual level strategies are important, but as I mentioned earlier, they're most effective when paired with upstream efforts to improve the environments and structural conditions that shape everyday experiences. Next slide, please. And so here, really zooming in, part 2 of the gender-based violence prevention framework also outlines the actions that local public health agencies can take when gender-based violence has already occurred to help reduce reoccurrence and also support recovery. And so these actions align with the tertiary prevention tier that Leah will explicate next. And public health has an important role here in this tertiary prevention tier, such as strengthening recognition of gender-based violence in clinical and community settings, supporting early identification, and facilitating timely referrals. However, our scope at this stage is more focused. Much of the direct response to incidents, survivor supports, and longer-term recovery falls within the mandates of our partner sectors, including healthcare, social services, child welfare, policing, and victim services. The framework acknowledges these complementary roles, and you can find more examples on page 19 of broader cross-sector actions to work alongside public health contributions to reduce harm and promote healing. Next slide, please. So here we're really going to focus on those pathways to advancing health equity, and we have examples from part 1 and part 2 of the framework. And so as I referred to earlier, population health approach not only focuses on understanding the distribution of the health issues and its determinants, but also on understanding the inequities in the distribution of the health issue. And so we really believe this focus on health inequities and the knowledge from the public health sector on advancing health equity can play an important role in gender-based violence prevention. So in part 1, the top row, you can see that the focus is on understanding the pathways that result in health inequities. And then we move to the strategies for advancing health equity in part 2, the bottom row. And so we drew from the World Health Organization Commission on Social Determinants of Health, Equity, and Public Health Programs. And this helps outline the 5 pathways that contribute to health inequities and strategies for advancing health equity. And this information can be used to, as I mentioned, understand the dynamics contributing to the inequities, also to intervene and to evaluate whether these interventions are actually reducing health inequities. Next slide, please. And so this image built on slide 1 illustrates 2 things: how the structures create unearned and unfair disadvantage for some groups, which increases their exposure to gender-based violence. So these disadvantages, such as discrimination, poverty, or limited access to supports, we want to emphasize are not the results of individual choices. They're built into systems. And this results in some groups experiencing differential exposure to gender-based violence along with differential vulnerability. So that is when the same conditions that increase the risk of experienced violence also intensify its impacts and reduce access to recovery supports. And this is why taking an equity-focused approach to gender-based violence prevention is essential. One other thing we wanted to highlight, that Stephanie Nixon's COIN model helps us to deepen this understanding and reminds us that unearned disadvantage is only one side of the story. On the other side of the coin is unearned privilege, the safety, protections, and access to recovery that some groups receive automatically because of how systems are structured. Recognizing both sides of the coin shifts our perspective. Vulnerability isn't something that people inherently have, it's produced by systems. And therefore, effective prevention means supporting those who face disadvantage, but also examining and disrupting the structures that concentrate privilege. Next slide, please. And so here we really wanted to give you some concrete examples within those 5 pathways to health inequities. And so at the societal level, this could include advocating for social and economic changes that address social stratification. This could include strengthening human rights protections, implementing public policies, and reducing inequities, as well as supporting healthy urban planning. At the population level, it could include prevention initiatives such as ensuring programs reach populations made vulnerable to gender-based violence and do not unintentionally widen disparities. And finally, at the people and families level, it includes addressing that differential vulnerability. So improving the relevance and cultural safety of gender-based violence services and supporting resilience amongst those impacted. So together, these entry points move us from just identifying the inequities to actively reducing them by addressing the root causes, improving access and responsiveness, and narrowing the gaps in the long-term outcome. And as I mentioned, they can also serve as a planning and evaluation tool to help us assess whether our efforts are working over time. I'm going to now hand it over to Leah to discuss how we might go about applying the framework at the local level.
Thank you, Marianne. Great. So, as Marianne said, now that we've walked through the framework, we're going to turn and look at an example of how local public health units and others can begin using it in practice. Just a caveat that this doesn't illustrate how our agencies are currently using the framework, but how the framework could work. The framework was only released in November of the last year. And in this particular example, we'll be using Ontario as our context, as that's the water that our team swims in. The steps here, though, are transferable to other jurisdictions and specific contexts. So before we get into that example, it's important to note that local public health faces a few challenges in influencing population-level levers for gender-based violence prevention. First, most of the levers are outside of the direct control of local public health agencies. Many of those policy levers sit with the provincial and federal government, with local governments and local agencies implementing the directions set at higher levels. This poses some limitations on what we're able to do at the local level. And finally, our local public health agencies often have limited financial resources to support population level work beyond the expertise and the time of our staff. So within this context, the way that we're trying to affect change is looking for partnership building, community mobilization, and healthy public policy work. And all of these strategies require communication and knowledge mobilization skills. Next slide, please. So a first step for us in moving the framework into action is finding a multi-sectoral table to work with on gender-based violence prevention. This is highlighted in part 2 of the framework as community or system planning. And this image here illustrates some of the partners who might have a role in preventing and addressing gender-based violence. Many people might think of the response services such as police, the interval homes, etc. But we also want to think about public health and schools and childcare and other partners who might not typically be at tables. We don't suggest that you find a new table to implement the framework with, but rather look at what already exists in your community. If you're anything like our community, there's already many tables that meet with the same organizations and the same people looking at different issues. Next slide, please. This slide here looks at what we think of as an ideal table within the Ontario context. We believe that community safety and well-being tables are a great way of implementing the gender-based violence framework. Ontario's Police Services Act requires that every municipality bring together a multi-sectoral group of community partners to develop and implement a community safety and well-being plan. Other municipalities and regions in Canada have voluntarily adopted this approach. One place to start for healthy public policy advocacy might be looking to formalize a community safety and a well-being approach within your community or your jurisdiction. And this would actually support recommendations from the Mass Casualty Commission's final report. So the image you see here of the Community Safety and Wellbeing Plan comes from the Ontario Chiefs of Police. And as you can see in the approach, it seeks to shift the focus from incidents of crime and violence towards understanding and addressing the underlying reasons behind the incidents by targeting the determinants of crime, which are pretty much the same as the determinants of health. Solutions can then be found to reduce the underlying determinants, thereby improving safety and well-being of the community as a whole. Next slide, please. This slide speaks to some of the principles that were identified through the literature reviews that Helly mentioned, including reviews of existing GBV strategies, plans, and reports. And these principles can be applied at planning efforts at any level, whether they are at the local, provincial, or national. Next slide, please. So now that we've identified our local planning table, the next step is to turn and look at selecting some actions that we could take to prevent gender-based violence in the population and advance equity in healthy and safe relationships. So there's a lot of ideas in the framework, and an initial challenge is to decide on which actions to focus on. One way of maximizing the potential for success in influencing the levers is to identify and amplify existing aligned policy priorities from the province and at the federal level. And this makes it easier to move prevention forward and get sustainable funding at the local level. The following slides will walk us through the process of first identifying the potential policy frameworks and moving it into the local level. Next slide, please. Pictured here are 3 relevant national policy tools that we could use in looking at how to implement the framework in Ontario. We've also illustrated some policy frameworks that are relevant to the Ontario context. You would need to look for which policy frameworks are available at your provincial and territorial level. Next slide, please. Among the options that were available to us, what we've done is starting to look at the recommendations from the study on intimate partner violence, which was tabled by the Standing Committee on Justice Policy in 2025 in the Ontario Legislative Assembly. And what we would do here is start to look at one or more particular policy frameworks and look for prevention opportunities that are linked in to the opportunities within the gender-based violence framework. So here you'll note that many of the items that we have identified at the structural level in terms of social, public policies and economic policies and norms and values are actually not directly focused on gender-based violence. Instead, they're actions that help families create warm, supportive environments for their children, and that also engage key settings that serve children and youth in denormalizing violence and also strengthening their capacity for healthy, safe, and equitable relationships. This reflects one of the principles that Marianne highlighted earlier about changing environments to change behavior. This also highlights the need to involve sectors who may not currently be actively involved in a community's community safety and well-being plan, such as your child care service system manager, your school boards, and the sports and recreation sector. Finally, I also want to take a moment to highlight that many of the actions on this slide would not only help to prevent gender-based violence, but would also contribute to other public health priorities, such as supporting children's healthy growth and development in general, promoting well-being, and reducing harms related to substance use. This is one of the benefits of when we move upstream, our actions have a positive impact across health topics. Next slide, please. So the next stop involves identifying and acting on opportunities at the local level to implement these provincial priorities. And this step is about being pragmatic. So hopefully the priorities outlined in the report that the Standing Committee tabled will be implemented, but there may be a time lag between there, or some of them may not get implemented. So we have opportunities to look at what we could do to move some of these ideas forward at the local level, and hopefully the province will come along with us in the long run. Some of the decisions that we would make in this area will depend on factors around our organization, as well as the organizations that are in our local area. So within Ontario, some of our local public health agencies are integrated within municipal or regional governments. For example, Ottawa Public Health, Toronto Public Health, Halton Regional Public Health. Staff from these agencies may already have a role in being able to develop their community safety and well-being plan for the municipality, and they may also have more ability to move forward recommendations related to other areas that the municipality is responsible for, such as sports and recreation or childcare. Other local public health agencies in Ontario are autonomous, and they may serve one or more municipal and regional governments. That's the case of both Marianne's organization and my organization. In our case, we need to identify the full range of community safety and well-being plans being developed across our area, as well as who's responsible for those, what resources are available in each of the smaller areas, and how we could go about engaging with them to influence their community safety and well-being planning. So the next 3 slides kind of speak about what local communities could do. And as you'll notice, this first one here, focuses on the living conditions in the local area with the aim of creating safe and equitable environments in key settings of daily life. The first setting being creating warm, nurturing, and safe home environments by reducing stressors for families and the supportive capacity to care for their children. I see that Nandini is 1 slide ahead of me, and I'm just going to catch up there. The other key settings that we would want to focus on are settings where children and youth spend a lot of time. That's schools, sports and recreation, and school-age childcare. And communities could focus in here on how to make these settings safe for the children who are participating there, including from peer-based gender-based violence, as well as providing education and skill building for healthy, safe, and equitable relationships. And these actions can support a shift in the level of gender-based violence as children become the next generation of adults. Next slide, please. The final set of actions that we could translate to the local level are efforts to end gender-based violence that's already occurring and support recovery. So one of those is developing bystander awareness and education campaigns, and within that, embedding firearm risk education into those resources and helping people understand what they can do when they're worried that someone who owns a gun is a risk to themselves or to others. In Ontario, our government has recently released a new initiative called the Men's Counselling Link, and something we can do at the local level is promote awareness of that and encourage men to seek out help before things escalate into a problem for themselves or others in their lives. Next slide, please. Now we'll turn to another question that we wanted to address through the framework, and that was clarifying what is the scope and the role of local public health in gender-based violence. So within this, we tried to, next slide, please. So this image here illustrates the 4 levels, the 4 tiers of prevention from primordial, which refers to actions that can be taken to ensure that risk factors do not develop and that protective factors are strengthened across the population, up to the tertiary, which is responding to violence that's already happened. And within this image, you can see that we envision local public health as primarily operating within the primary to primordial levels, because this is where we can strengthen social and structural conditions that prevent gender-based violence from occurring in the first place. Next slide, please. And these are the roles that we identified for local public health. These roles will be familiar to most people. They're very common within public health. The one that will be new is championing and supporting a population health approach to addressing gender-based violence. And within that, what we were looking to do is help to foster a paradigm shift, much like the move that was seen in health promotion, encouraging people to shift from a clinical model towards focusing on health as a resource and what can be done to foster well-being. The same thing happened in mental health promotion. So we're hoping to help people broaden their perspective of responding to violence after it occurs to strengthening the social, economic, cultural, and environmental conditions that support healthy, respectful, and equitable relationships. The roles we envision for public health very much reflect what you can see in the recently released core competencies for public health in Canada. As a starting point, we've really encouraged people to think about how their public health work already contributes to gender-based violence prevention, where they can reorient or reframe their work so the links are more clear, and also to identify any gaps. Next slide, please. Whoops, I'm 2 slides ahead of you. Sorry, Nandini. One more. Great. So as you move forward, there's many ways that you could use the population health framework. One, at the local level, you can look at how to use it to guide your population planning and the development of your interventions. At your regional level, you can use it to bring your partners together and develop a common language and figure out a way of moving together forward. And at the provincial and national level, it can be used to help figure out how to better involve the public health system in gender-based violence prevention, as well as it may be relevant to people outside of the public health sphere as they look at how they're preventing violence. Final slide, please. And on that note, I want to leave you with one core message, and that's that everyone has a role to play in ending gender-based violence and fostering healthy, safe, and equitable relationships. Public health is an important part of this work, but it's truly a collective effort. And if you have any questions, please reach out to Marianne, and she will provide the information out to our team. Now, Nandini has another question for you here. So if you join back in at Slido, you will see that we have a question here that after today's session, which of the following purposes do you think you might use this framework for in your work? To build support within your organization, to identify and inform initiatives to prevent GBV in your area, to support and strengthen community planning, or something else. Please let us know.
Thanks so much, Leah, and so thanks so much all of you for that fantastic tour of all of the work that you've been doing around preventing gender-based violence, and very importantly, co-creating and co-developing that framework that can provide guidance to taking action to prevent gender-based violence. So I can see that quite a few of you have joined the Slido poll. We have about 48 people who have joined, and there's a lot of ideas about how people can use the gender-based violence prevention framework, so to support or strengthen community and system planning efforts in your area, to identify or inform population level initiatives to prevent gender-based violence, and to build support within your organization for addressing gender-based violence as a public health priority. So thanks so much, everyone, for taking part in that Slido poll. And this is just some select references from the Gender-Based Violence Framework document. And I think we'll share that link to the framework in the chat again, where you'll be able to see the full list. And now we're over to the Q&A section. So I'll invite all of the speakers to turn their cameras on, because there were a lot of questions and comments in the chat or in the Q&A box that I wanted to invite you all to be able to respond to. So one of the questions, and I think there are many really important questions. So one of the comments or the questions that came back from one of the participants was that in terms of the categories of equity denied populations, there is mention of newcomers, of LGBTQI plus communities, and then there's a question, why isn't anti-Black racism identified and acknowledged? And also a question as to why equity denied Black populations haven't been identified. So maybe one of you, if you'd like to respond to that question, and then I can move on to a related question. So who would like to
I can start, and then Helle, or if anyone else wants to jump in. So thank you for identifying that, and that is absolutely some work that we are embarking on here at TBDHU. So a gap that we've identified, and traditionally, a lot of our work has focused on Indigenous populations, right? And just like Nandini's land acknowledgement highlighted, that we also need to focus on anti-Black racism. And so I would say that it might not have been something that came out in the literature reviews as much, but is absolutely an equity denied population that we want to be addressing.
That's great. Thanks so much, Marianne, and appreciate that humility and just acknowledging that it's a missing population right now from your framework, and recognizing that, as with most documents, these are sort of ever evolving and living. Related to that, sorry, I'm just looking at my phone to see the other questions. Related to that was just sort of a question around the structural determinants of health. And I think you have touched on this, but maybe I think further explanation I think would be very useful. Is how does your framework account for intersectionality and the structural determinants of health? So, for example, racism, poverty, immigration status, rather than just addressing gender-based violence as an individual level issue. So maybe one of you could just speak to that around intersectionality and the role of structural determinants of health in your framework.
Yeah, I think that was kind of a starting point for where we began with the framework. Helle had mentioned that we really wanted to move away from the socio-ecological model and instead get into a population health approach and looking at the pathways to inequity to kind of better explicate where those dynamics are happening, and how it appears. So it may not, I know we within the document, it does refer to intersectionality, but we've really tried to provide more of a roadmap that people can use for planning rather than each of the solutions. So it would be about taking the overall approaches and information and working to understand how it is relevant to a community group that you are working with. Does anyone want to add to that among the...
I can add a little bit. Thank you so much, Leah, and thank you for that excellent question. When we look at the intersectional determinants of health, or the intersectionality of the determinants of health, I think what public health can do and support the addressing gender-based violence is serving as advocates. I mean, we have access to local statistics. We have access to local groups and organizations that are already conducting work on addressing gender-based violence. And we need to collaborate with the groups that are doing that work and get guidance from the groups in terms of how we can best support the advocacy work that groups are already doing. This work that we've been doing could not exist without the work that everybody else has already done. And it's really important that for people to see this as something that can potentially support work moving forward while acknowledging that lots of work has preceded this, and the continued collaboration is really where we need to go in terms of addressing the upstream factors that contribute to gender-based violence.
Thanks, Helene. Appreciate those reflections. Sort of connected to something you were just mentioning now, Helene, and which you had spoken to, Leah, during your section of the presentation, is someone is also asking if you can share some examples of projects to support healthy relationships among adults. Because recognizing that there are a lot of initiatives in place at the youth level, but it would be good to know if there are effective tools for when people reach adulthood or are already adults. So just interested to know if you have any thoughts or comments on that.
I can start. I feel like I'm addressing the gaps a little bit. So we focus a lot of the examples that we have, and indeed something that we're doing in Thunder Bay is focusing on healthy relationships for youth, but acknowledging that youth in different definitions, and indeed one of the projects we have promoting positive and healthy youth relationships that's funded by the Public Health Agency of Canada, really the definition goes up to 29, right? And some of the youth we address in community settings could be of all ages. So I think that is one example of, it's not just younger kids. Acknowledging too, when we're doing prevention and that healthy relationships work, we want to focus earlier in the life course, right? To build those knowledge, skills, and attitudes and that culture of prevention. But also, it's similar to other things that we talk about, like adverse childhood experiences, et cetera, and sort of that recognize and respond piece, right? That we as adults could use some guidance. I think there's other examples of, but again, it's more like parenting programs or early relational health or caring dads. Other examples that I sort of can think about are the Moosai campaign. So again, that's something that's a national campaign, right? And focuses on bringing in men and boys to preventing gender-based violence. So it's not necessarily a program, but is an example of something that's targeted at adults. But yeah, if anyone else has examples or they want to put them in the chat, I see someone has something here, then yeah, we'd be happy to learn about them.
Adding to what Marianne said, I think a challenge for public health is that it's easier for us to reach people in settings such as schools, on campuses, etc. It gets more difficult to reach people in adulthood other than trying to change the determinants of health.
Actually, I'll say one other thing. So one place that we do focus on in public health can, for adults, can be workplaces, because we know that's somewhere that we can reach adults. And we do a lot of work on psychological health and safety in the workplace and mental health promotion, which indeed are aspects that improve our relationality, right? And social interaction. So that again is something, and I think that goes back to something that Leah said, that indeed when we look at addressing those upstream determinants, that really we're addressing more than one topic. So
a couple of sort of more technical questions, one was around who were the experts who were involved in the Delphi process? So what kinds of experts did you engage in that Delphi process to co-develop the actual framework?
I can go give a stab at this. So we included people that have expertise working with gender-based violence in various ways, both from a preventative perspective and people that are working as on quotes unquote in the communities, people that are researchers, people from the ministries, people from public health agencies across Ontario, Association of Municipalities, and the work that is shared through them. I mean, we really had a wide range of people that have been having experience working with gender-based violence in the past. Is there any that I have forgotten, Leah, Marianne, Oriana, Nana?
And I guess with that AMO, the Association of Municipalities, also people representing community and safety well-being strategies. I can't remember if you said that. So yeah, we touched many sectors.
Wonderful. And one last question, recognizing we have 1 minute left, just shows the level of interest in the fantastic work that you've been doing. Can you share a bit about why you wanted to move away from the socio-ecological model?
That really was an opportunity to get into health equity. Like at the core of gender-based violence is equity issues. Even just the term gender-based violence and it disproportionately affecting women as one level of intersectionality, women, girls, and women, it was really important for us to think about kind of what's going on and what can we learn from health equity strategies to be able to address these issues and help people understand the systems of inequity in a more fulsome way.
Thank you, Leah. That's a wonderful way to end this webinar, to really highlight that underlying gender-based violence is systems of oppression and different forms of inequity, and that's where the sort of intervention focus really needs to target. So thanks everyone for joining today's webinar, and we'll be sharing the slides on the NCCDH website. And we also invite you to complete the evaluation. We're always interested in learning about how we can improve. And also just again, I see a lot of hearts and clapping hands coming up through the webinar screen. Just again, want to thank all of you for this excellent work that you've done, and look forward to seeing where all of this goes. So thanks everyone, and wishing you a great rest of the day.
Thank you so much.
Thank you to everyone.
Thank you, everyone.
Thanks everyone for your feedback.